Hello, my name is James Hales, and today we're going to explore the diagnosis and management of depression in children and adolescents. This issue is critical as untreated depression can severely impact academic performance, social relationships, and overall development. By understanding the signs, challenges, and treatment strategies, we can make a positive difference in the lives of these young people. Let's get started. Depression among youth in the United States is on the rise. According to the National Surveys on Drug Use and Health, which included over 172,000 adolescents aged 12 to 17, the prevalence of major depressive episodes increased from 9% in 2005 to 11% in 2014. By 2016, this figure had risen to approximately 13%, with younger adolescents showing significant rates as well: 5% at age 12, 13% at age 14, and a concerning 17% at age 17. Despite these alarming statistics, only about 40% of these adolescents with severe depression are receiving treatment, a rate that has seen little improvement since 2005. This highlights a critical gap in healthcare to these young people, and I think we can do better. The pathophysiology of depression is complex and not yet fully understood. However, several mechanisms and factors are believed to contribute to its development. One key factor is neurotransmitter imbalance. Depression has been linked to imbalances in chemicals like serotonin, norepinephrine, and dopamine, which play crucial roles in regulating mood. Genetic factors also play a significant role. There's strong evidence suggesting that depression can run in families, indicating a hereditary component that increases the risk of developing the condition. Brain structure and function are another important area of study. Imaging studies have shown differences in the brains of people with depression, including changes in the size of certain regions, such as the hippocampus, and altered activity in brain circuits involved in mood regulation. Lastly, hormonal factors can influence depression. Imbalances in hormones such as cortisol, which is a stress hormone, and conditions like hypothyroidism are linked to depressive symptoms. Understanding these factors help us appreciate the complexity of depression and underscores the importance of a multifaceted approach to its diagnosis and treatment. Effective screening and diagnosis are vital steps in addressing depression in children and adolescents. Annual screening is essential as it helps in early detection and timely intervention. Regular checkups provide an opportunity to identify depressive symptoms that might otherwise go unnoticed. It's also crucial to rule out other medical conditions that can mimic depression, such as thyroid disorders or anemia. These conditions can present with similar symptoms but will require vastly different treatments. Additionally, we must consider other relevant psychiatric diagnoses beyond unipolar depression, such as bipolar disorder, anxiety disorders, and ADHD. Comprehensive assessment ensures that the right diagnosis is made and appropriate treatment is provided, addressing the specific needs of each young patient. Screening tools like the PHQ-A and ASQ are vital for managing depression in adolescents. The PHQ-A helps clinicians identify and monitor depressive symptoms regularly. The ASQ is crucial for suicide risk, the second leading cause of death in youth aged 10 to 24. A study showed that 53% of those who screened positive for suicide risk with the ASQ did not initially present with suicide-related issues. The ASQ has a high sensitivity of 93% for predicting suicide risk. These tools ensure the early detection and effective intervention, providing essential support for at-risk youth. Managing depression in children and adolescents effectively requires a comprehensive approach. Here are the key treatment recommendations. First, annual screening for depression using validated tools like the PHQ-A is essential. For initial management, supportive care and close monitoring for 6 to 8 weeks is advised for mild depression before considering pharmacotherapy or psychotherapy. For moderate to severe depression, fluoxetine and escitalopram are recommended medications, but it's crucial to monitor for suicidality closely. Psychotherapy, such as cognitive behavioral therapy, can be highly effective, especially when combined with medication. Combining antidepressants with psychotherapy often results in better outcomes. Regular reassessment is important to adjust treatment plans as needed, and referrals to specialists should be made if symptoms persist or worsen. By following these strategies, we can ensure that young patients receive the comprehensive care and support necessary to manage depression effectively. Let's consider a case study to illustrate the concept we've discussed. Meet Alex, a 14-year-old student who has been feeling increasingly sad and withdrawn over the past few months. His teachers have noticed a decline in his grades and participation in class. At home, Alex spends most of his time in his room and has lost interest in playing soccer, which he used to love. During a routine checkup, Alex's primary care provider uses the PHQ-A to screen for depression. The results indicate moderate depressive symptoms. The provider prescribes fluoxetine and recommends cognitive behavioral therapy. Over the next few months, Alex's symptoms begin to improve. Regular reassessments help adjust his treatment plan as needed, ensuring he receives the appropriate care. This case highlights the importance of screening, timely intervention, and a comprehensive treatment approach in managing depression in adolescents.